Well, right now, COVID-19 is dominating the health headlines, but at Arizona Oncology, doctors there continue to fight the good fight against cancer. And one of their patients, Emma, well, she beat the odds. She's a success story that is sure to inspire anyone who is battling a serious illness or disease. Christmas Eve a few years ago. It was supposed to be a happy time. Emma Villa's daughter was pregnant with Emma's first grandchild.
I actually have my sweater covering my belly because I was trying to hide it.
Emma says she was swollen, as big as her pregnant daughter.
So we decided to go the next day, which was Christmas, to the hospital to get checked.
A CT scan revealed 3 large tumors on her ovaries and liver.
This was probably the size of a lemon. The second that they found was about the size of an orange, and the other the size of a, what do you call it, a grapefruit, yes.
A lot of women think when they come into their gynecologist, they're getting screened for ovarian cancer, when they are not. They are getting their pap smear, which is a screening test for cervical cancer. Obviously, we have screening tests for breast cancer with mammograms or colon cancer with colonoscopy, but there is no screening test for ovarian cancer.
That's why Dr. Lyndsay Willmott from Arizona Oncology says that most cases of ovarian cancer aren't caught until the late stages. When Emma came to her, Dr. Willmott got right to work, starting with chemo.
There are very few things that I can promise them, but one thing I can promise them is that we'll be there by their side through their journey and help to support them.
After months of chemo, Emma asked Dr. Willmott to schedule her surgery before her grandson's due date, so Emma could be there when he was born.
To my surprise, when I was back in the recovery room, I was in ICU, I found out my daughter had my grandson on the day of my surgery.
But it turned out to be a blessing because that date would not be remembered as her surgery day, but instead Noelle's birthday. And although Emma had so much to live for, her battle with cancer would not be done just yet. She had the BRCA1 gene. Emma underwent a hysterectomy and mastectomy, and Dr. Willmott helped her find a trial study that gave her access to a medication called a PARP inhibitor.
Cancer cells are a lot like someone who has a broken leg and they're relying on their crutches to, get themselves around. The PARP inhibitor basically steals those crutches away so that the cancer cells can't walk anymore.
Dr. Willmott says the PARP inhibitor crippled the cancer cells, buying Emma more time to watch her grandson grow.
Oh, he loves to dance. He is a dancer. He's 2 years old now.
And Emma is dancing right along with Noelle. She says she's now cancer-free. And we love to hear success stories like that. You go, Emma. So during the pandemic, Emma says that life has been more restrictive for her than others because of her now compromised immune system, as you might imagine. But she feels like she's been given a second chance of life, and she wants to tell everybody about genetic testing for cancer-related genes. She's talked to her family members. They've gotten tested and even got treatment as a result of learning that they, too, have the BRCA1 gene.